Hello, I'm Christy Rika, and this is my informative speech. I'd like to introduce my audience. I have Joey, I have Baby, and I have Joseph. So now I'd like to inform you about something that's dear to my heart, and that's being a neonatal intensive care nurse. I've worked with neonates or premature babies for 9 years. I'm currently employed at St. Luke's Hospital in a level 2 NICU. There are several reasons that I love being a NICU nurse. One reason is that I'm able to use critical thinking skills and be an advocate for the tiniest of patients. Another reason I love being a NICU nurse is because it is a field that is continually evolving. I also feel it is amazing to witness one of life's greatest blessings to be a part of true miracles every day. As a NICU nurse, I like to consider myself as the eyes and the ears of the neonatal doctors. While our neonatologists are always readily available, my assessment and critical thinking skills are critical for identifying potential issues that the infant may present. Oftentimes, just a slight adjustment in the infant's vital signs or assessment can be a great indicator that a problem may be presenting itself. Also, because the infant is unable to verbalize if he's hurting or if he's getting sick, then it is my job to make sure that I am perceptive to the infant's emotional needs as well as his or her physical needs. Right now, I'd like to show you some of the stuff we use in the NICU so you compare it into regular baby size and adult size. This is a onesie that a regular size newborn could fit into. I'll pass it around. This is a onesie that one of our little 2-pound, 4-ounce little baby girls likes to wear in the NICU. This is a regular newborn size diaper, and this is a little tiny diaper that a 2-pound, 4-ounce baby can wear. This is a regular adult size blood pressure cuff that you may be familiar with, and this is a blood pressure cuff that we use in the NICU for the littlest of our patients. This is a chart of 3 different size babies. This one being a normal size newborn baby. This one being about a 4-pound, 5-ounce baby, and this one being about a 2-pound, 3-ounce baby. So we get all sorts of sizes in our NICU. Since the 1980s, neonatology has changed dramatically, and according to the Journal of Perinatology, the single most important advancement in neonatal medicine occurred. Its name is Survanta. Survanta is a medication that's placed in the neonate's lungs via endotracheal tube and allows an increase in lung clamp. Without Survanta, the infant's lungs become stiff and they collapse. So Survanta works like WD-40 and lubricates the lungs so that they may stay open, and it decreases the tension in the lung field so it can facilitate better oxygen exchange. According to the Journal of the American Academy of Pediatrics, Survanta is responsible for a 70% decrease in neonatal mortality rate. During my 9-year career, I've had the pleasure to witness some profound miracles, and I've been blessed by so many amazing infants and their families. For instance, my nursing career has been deeply affected by a tiny 2-pound, 8-ounce baby boy. Odds were against him from the start, but he refused to give up. Daily, he fought for his life, and there were times I was not sure he was going to pull through. But amazingly, after 64 days in our NICU, he was discharged home to his family. And about a year later, I had the pleasure to run into him and his family at the mall, and I was happy to see that such a tiny, sick little baby boy had grown into a very happy little toddler. He is truly a miracle. And in closing, I am so blessed to have such a fulfilling job that I feel that as if I didn't choose neonatology, that it chose me. Thank you.